So all this technology around us, one area that we haven't talked about yet is healthcare data and how that technology can help. So let's talk about that.
I'm Martin Tiani from Tiani Spirit and Grapevine. We are producing building blocks, software-based for interoperability. We are doing this more than 20 years.
When we were off camera, we talked about a lot of things, the entire digitization world. But we talked about it from the standpoint of health data and the collection and dissemination of that. Can you kind of give us the big picture of what some of the issues are today?
You know, the biggest issue, if we talk about the big picture, is that it's not that easy that companies like pharmaceutical companies are able to get access to health data. It has something to do with the data protection, of course, because you have to get the clearance from the patient itself that you are able to get access. And what we are trying, of course, is to connect the public sector with the private sector, also on an international base.
And when we talked about it earlier today, we talked about it from the standpoint of it's not only country specific, but there's a desire or need to have this data spread out across the world. And you talked about some of those issues in general.
Yes, you know, if we talk about medical tourism, it's also a topic. Yeah, if somebody is going for skiing to Austria, is breaking the leg and is going back, it's not that easy to get access to your data. Yeah, so and also the WHO organization is trying to get data for the immunization, tuberculosis globally, and if you want to get access really globally, that's a real issue. That's really difficult. It's not that easy.
Let's talk specifically about what your company does and what it is you're trying to achieve.
We are building together with our stakeholders and system partners like also Deutsche Telekom, like Microsoft. They are also partners from Grapevine. We are building up a so-called Grapevine World Backbone. It is a network we're supposed to be easy to get access to the health data. Of course, you have to always consider the data protection, HIPAA compliance and GDPR rules. But this is what we are doing now over the next, let's say, 3 up to 5 years. We are building up 100 nodes worldwide so that you are able to get easy access to the data. Für uns persönlich ist es ein logischer Schritt, dass das Muster, das Telco-Provider über Jahrzehnte mittlerweile tatsächlich umsetzen, dass wir das Muster wiederverwenden. Diese Services, von denen ich gerade gesprochen habe, die müssen letztendlich beim Telco-Provider landen und wir haben mit der Deutschen Telekom letztes Jahr eine große Partnerschaft geschlossen, damit wir mit der Deutschen Telekom auch diese Services providen können. Letztendlich geht es darum, wie schnell und wie einfach kann man unterschiedlichste Organisationen connecten und wie einfach kann man dann letztendlich Daten austauschen, immer unter Berücksichtigung des Datenschutzes. You know, it's really challenging. In every country you have a different legislation, so you have to overcome somehow the hurdle. And especially also California, you know that they brought out a new law. And let's see what will happen. From our standpoint, we see a chance that with involving the patient itself, that we are able anyway to overcome this hurdle. And what we try is to do a kind of polarization. So if let's say the patient is willing to share the data, why not? Then it's the decision of the patient and not the decision of somebody else. Yeah? We are fighting for the freedom, of course, of the citizen.
I know you've been very, very busy at this event, so I really want to thank you for taking your time.
I have to say thank you for this invitation, and hopefully that some people can take away something out of it.
They will, believe me, they will. Thank you. Bye-bye.
You're welcome. Thank you.